Hey guys, so today I've started to do a video on the lymphatic drainage of the whole body. So we'll start from the head and neck area and then we get to the foot. So basically you need to understand the difference between a lymph vessel and a lymph node. So the nodes are the ones that actually filter the fluid and they're the ones that are ovoid in shape. Then the lymph vessels will actually drain the nodes. So lymph actually is excess tissue fluid that is being drained from the interstitial spaces, and then that lymph that actually arises from the region of the abdomen will consist of chyle, that is digested fat, that is absorbed in those lacteal vessels, which is why the commencement of the cisterna chyli will actually, or rather the commencement of the thoracic duct will be referred to as the cisterna chyli, since it actually receives the intestinal lymph tract that has cow. So as I said, we'll start with the lymph drainage of the region of the head and neck. So we have regional nodes in the region of the head and neck that actually ultimately drain into the deep cervical lymph nodes. So these regional nodes are arranged in circles. You have an outer circular layer, or the cervical layer of lymph nodes. Then you have the inner circular layer of lymph nodes. That is the one that you actually have in the neck. So the pericervical will actually be on the junction between the head and the neck. So it's circular. So for you not to forget, you have a submental lymph node, then you have submandibular lymph nodes, then you talk about the preauricular lymph nodes, then you talk about the retroauricular lymph nodes, or rather the mastoid lymph nodes, then you talk about the occipital lymph nodes. So these will actually form the pericervical lymph nodes, or the outer circular layer of these lymph nodes. So the occipital lymph nodes will drain the posterior part of the scalp. Then the mastoid lymph nodes will drain part of the scalp, as well as the posterior part of the external meatus. Then the anterior part, of course, would drain into the preauricular, and then the submental would drain the tip of the tongue and the region just below the tongue. Then the submandibular effectively will receive the buccal lymph nodes. The buccal lymph nodes will actually be the facial lymph nodes that course with the facial vein, and then the submandibular lymph nodes will actually be the, what can I say, the ultimate drainage of most of the lymph from the face area, as well as the vestibule and the the greater part of the tongue, and even the cheeks and stuff. So we've talked about the submental, then we talked about the submandibular, then the preauricular, the retroauricular, then the occipital lymph nodes as well. Then all this will ultimately drain into the deep cervical lymph nodes, which I'll talk about in a moment. But before I talk about those, we can now talk about the inner circular layer now, that consists of the prelaryngeal, then you have the retropharyngeal, then you have the paratracheal and the pretracheal lymph nodes. So the names are self-explanatory in terms of their location. Paratracheal on the sides of the trachea, pretracheal in front of the trachea, prelaryngeal in front of the larynx, preferred that cricoid cartilage. Then the retropharyngeal lymph nodes will be found in that retropharyngeal space, posterior to the pharynx and anterior to the deep, sorry, to the prevertebral fascia. Remember the fascial layers of the neck. Then then all these will ultimately as well drain into the deep cervical lymph nodes. The pretracheal and paratracheal also drain the thyroid gland, as well as the viscera of the neck. Then, as for the deep cervical lymph nodes, these will eventually feed into the jugular lymph trunk. So this jugular lymph trunk will consist of all the lymph from the head and neck. So this deep cervical lymph nodes, you have the jugular digastric node that is actually in a triangle that is being formed by the anterior belly of the digastric, as well as the facial vein and the external jugular vein, that's jugular digastric node. And then this is effectively also known rather as the node, the lymph node of the tonsils. It also drains the palatine tonsils. Then the jugular omohyoid node also known as the node of the tongue, as it drains the tongue. The jugular digastric also drains part of the tongue, and then that's just about it in relation to the deep cervical lymph nodes. Then they form the jugular lymph trunk, who then go and drain into the thoracic duct, or the right lymphatic duct, depending on the site. Then we also have what we call the Walde's lymphatic ring, or which is formed by those tonsils. You have so it's sort of diamond shaped. You have the pharyngeal tonsils, then you have the tubal tonsils, then you have the palatine tonsils, and then you also have so I've talked about the tubal tonsils, the palatine tonsils, then more anteriorly of the lingual tonsil. So these will effectively drain into the 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 paracervical nodes that I talked about earlier on, then drain ultimately into the deep cervical lymph nodes. So this paracervical will also have efferent vessels that would then go and feed into these deep cervical lymph nodes. Then so we now have these nodes, deep cervical nodes. Then you also find there are other nodes as well, the anterior cervical nodes that actually course with the anterior jugular vein. Then you also have the superficial cervical nodes that course with the external jugular vein. So for you not to forget, the superficial ones will actually be with the external jugular vein, and the deep ones will actually be posterior to the internal jugular vein, or embedded in the tunica adventitia of these vessels. So that's the lymph drainage of the head and neck. Now we have these right and left jugular lymph trunks. So they may also drain into the subclavian lymph trunks. The subclavian lymph trunks will have let me not generalize it. Let me just talk about how we have lymph being in these subclavian lymph trunks before we talk about how they will drain. So from the region of the upper limb, you have drainage into the lateral axillary lymph node that will be on the major side of the axillary, of the axillary vein. So from the medial side, you have drainage into the supratracheal lymph nodes. The supratracheal lymph nodes will be in the roof of the cubital fossa, and then from the lateral side, you have lymph actually coursing upward from the arm, the hand, and then the forearm as well, into the infraclavicular lymph nodes. And then you find there's also an anterior axillary lymph node that actually has lymph from the anterior abdominal wall to the level of the umbilicus. This anterior axillary lymph node is found at the lower border of the pec minor, behind the pec major, so it's also called a pectoral lymph node. Then you find the subscapularis lymph node, or the posterior axillary lymph node, that actually has drainage from the posterior body wall up until we get to the iliac crest. So I've talked about the posterior and the anterior and the lateral. These will effectively drain into the central axillary group of lymph nodes that is at the center of the axilla. Then at the apex of the axilla, we'll actually have all these axillary lymph nodes together with the infraclavicular lymph node, though not a true node of the axilla, draining to this apical axillary lymph nodes. Then the apical axillary lymph nodes will then feed into the subclavian lymph trunks. Then this subclavian lymph trunks, together with the jugular lymph vessels, will then drain into the brachiocephalic vein on the left, and then also the brachiocephalic on the right as well. But then they may drain into these veins directly, or they may drain into the thoracic duct and the right lymphatic trunk, and then these trunks will then drain into the veins. So whatever it is that may happen in the body is still normal. So yes, I've talked about the thoracic duct. Let me now start with the thoracic duct. The thoracic duct emerges from the cisterna chyli. The cisterna chyli will be formed by the intestinal lymph trunk and two lumbar lymph trunks. So these will then feed into the cisterna chyli that then emerges now as the thoracic duct. So since I've talked about the intestinal trunk, as I mentioned earlier, they will have chyle, the yellow fluid. So any lacerations of the thoracic duct may have problems within the region of the thorax, where it will actually cause as well. So it emerges through the aortic opening in between the aorta and the azygous vein. So the azygous vein is more to the right, and the aorta is more to the left. So this thoracic duct starts on the right side of the esophagus, then actually causes behind it to come and lie on the left side, that is at the level of the sternal angle, then with an arc upward in front of the vertebral vessels, that is the vertebral artery and the vertebral vein, and then behind the carotid sheath. So the interrelations of that will be the things that you find actually in that carotid sheath. That is the vein, the artery, and the nerve, the vagus, the internal jugular vein, as well as the carotid artery. Then it will then join the brachiocephalic the brachiocephalic the brachiocephalic vein, and then so ultimately it drains all the lymph from the region of the foot up until we get to the abdomen and stuff. That is effectively the whole body, if it actually receives the lymphatics from the jugular trunks and the subclavian trunks on the left side, on the right side, or and as well as on the right side, that is below the abdomen, going to the foot as well. But then the right lymphatic duct will actually drain the region of the head and neck on the right side. Then so yeah, as well as when it actually joins the brachiocephalic vein, it does so in front of the phrenic nerves. Um, then as for the lymphatic drainage of the the lower limbs, you now talk of how from the lateral side of the foot, and then of the leg, these will actually drain as well as into the popliteal nodes. Then all the other lymph node would then drain into the inguinal lymph nodes. So these inguinal lymph nodes, we have a horizontal group and a vertical group. So the vertical group, ultimately they drain all the lymph from the lower limb. Then so we'll now talk about the deep lymph nodes. Sorry, before I go to the deep lymph nodes, we have the horizontal group side. The horizontal groups, you have a medial and a more lateral one. The more lateral one will drain the region of the back, that is the buttock area. Then the more medial one will drain the external genitalia, that's the pituitary, with the exception being the testes. And then as for the deep ones, the deep cervical nodes will then effectively receive all the lymph from these superficial inguinal nodes. So the most superior one is just behind the inguinal ligament. It's known as the Klupert's, I don't know how it's pronounced, inguinal lymph nodes. Then these will then effectively drain into the external iliac nodes. External iliac nodes will then drain with the internal iliac nodes. That is the drainage of the perineum, of the pelvis rather, and then from the common iliac trunks. Then as for the region of the abdomen, they'll effectively drain into the pre-aortic nodes. The pre-aortic nodes, the celiac nodes that drain the foregut, the superior mesenteric that drain the midgut, and then the inferior ones that actually drain the hindgut. Then these will then form the intestinal trunk that we did talk about, eventually forming the cisterna, draining into the cisterna cali rather, as well as the two lumbar trunks that will have all that drainage from the foot, but then from the foot and the lower limbs, that is effectively via the common iliac nodes. Then that's just about it.